In the previous video, we take together reduction of the fracture, which is the first step in treatment of fracture. The next step in treatment of fracture is fixation, or also called immobilization of the fracture. What is the aim of this fixation? We reduce the fracture. What maintain this reduction? And what maintain the normal anatomical position? Therefore, fixation and the perfect fixation is essential. And the aim of fixation is to maintain reduction and fix the fracture fragment until evidence of complete union occur. How to know complete union? Two things: loss of pain and tenderness over the fracture, and X-ray show disappearance of the fracture line. What are the methods of fixation and immobilization? The commonest method for fixation or immobilization is external fixation by plaster of Paris. Plaster of Paris is also called BOP. Plaster, P of O, Paris, B, abbreviation BOP. What is the indication of plaster of Paris? The indication of plaster of Paris, it is always tried first, and the first choice after closed reduction. Therefore, always in orthopedic, there is association between closed reduction and external fixation. External fixation by plaster of Paris is always tried first. Why? Because it have many advantages. First of all, and the most important, cheap, safe, and does not need extensive facilities. What is the shape of plaster of Paris? If the plaster of Paris surrounds the whole limb, it is called cast. If plaster of Paris is applied and does not surround the whole circumference of the limb, like this, it is called the slab. This is called posterior slab because it is applied on the posterior aspect of the limb. Therefore, slab doesn't, plaster of Paris doesn't surround the whole circumference of the limb. May be applied to one aspect of the limb like this, which is called the posterior slab. And sure, the posterior slab is fixed by a piece of gauze which surrounds the limb. Plaster of Paris may fix the limb and the part of the trunk. If plaster of Paris is applied to the limb and the part of trunk, it is called spica. Spica may be used for hip joint disease and called hip spica. Or the spica may for the upper limb, may be applied for the upper limb fixation with the trunk. If trunk with the upper limb, it is called shoulder spica. Plaster of Paris may be applied to the neck and called collar. And this is rarely used, plaster of Paris now, as a collar, and it is replaced by orthosis as a collar. Or plaster of Paris may be in the form of a jacket. jacket to fix the thoracic or lumbar vertebrae, while collar is used to fix the cervical vertebrae. And if we apply plaster of Paris to fix the head with the neck and the trunk, it is called Minerva. Minerva, this is a Minerva. Fixation of the head, cervical spine like a collar, and with a jacket in the same time, it is called Minerva. And this is replaced nowadays by orthosis, as we will see in fracture vertebral column. Plaster cast may be a cast brass. This is a cast brass. What is this? Plaster of Paris is applied to the side, and a plaster of Paris is applied to the leg, and the two parts of the plaster of Paris are connected together by a hinge. For the Arabic student, بنفصلها. Okay, these are the different shapes of plaster of Paris. If surrounding the whole circumference of the limb, it is called the cast. Applied to one aspect of the limb, it is called slab. Limb and part of the trunk are fixed, it is called spica. Hip spica or shoulder spica for the upper limb. Or collar, or jacket, or Minerva, and cast brass. What is the duration? Before we take the duration, look for these are the different types of plaster of Paris: slab, cast, jacket, hip or shoulder spica. This is the hip shoulder spica, and this is the hip spica. If hip spica is applied on both sides, it's called pantalon. This is the collar, and this is Minerva. What is the duration of application of plaster of Paris, and what is the time needed for fixation? What is the time needed for fixation of the fractures? I put this drawing for easy and very easy study of the duration for fixation of all fractures all over the body. If there is a minor fracture in the trunk, minor fracture in the trunk like fracture clavicle or fracture rib, it is fixed for 3 weeks. If there is major fracture in the trunk, major fractures in the trunk like fracture pelvis, or other major fractures like fracture femur or fracture spine. Fracture, the 3 major fractures in the body: fracture pelvis, fracture spine, and fracture femur are fixed for 3 months. Therefore, minor fracture in the middle line or in the trunk, 3 weeks. Major fractures, which are 3 major fractures, pelvis, spine, femur, fixed for 3 months. Fracture or dislocation of shoulder. Dislocation of shoulder, 4 weeks. Fracture in the arm, which means humerus, fixed for 4 to 6 weeks. Fracture in the forearm, 6 to 8 weeks. fractures in the leg. Fracture in the leg 10 to 12 week, and the fracture femur is 12 week, which is 3 months. Therefore 3 months or 3 weeks in the trunk or major fractures in the body, then 4 weeks, 4 to 6 weeks, 6 to 8 weeks, 10 weeks, and 12 weeks, which is femur, which is mentioned before 3 months. What are the rules of application of plaster of Paris? First of all, the limb should be padded with cotton, especially put marked amount of cotton on the bony prominence. Then we apply the plaster cast. We apply the plaster cast, which should be accurately molded to the limb, not too tight, not too lax. And the fixation should include the joint below and the joint above the fracture to fix the fractured bone. And the patient should be hospitalized after application of the plaster cast for at least 24 hours to observe the distal circulation of the limb, for fear of tight cast may compress the vein leading to edema, compression of veins leading to edema, compression of arteries leading to Balor's acute ischemia, or compression of nerves, sensor loss. The edge of the cast should not sharp or compress the skin. If sharp or compress the skin, it is like a knife. It will lead to injury of the skin and ulceration. What are the complications of plaster of Paris? If the plaster cast is too tight, it leads to compartment syndrome or compression of arteries leading to Volkmann's ischemic contracture, which will be discussed later on in complication of fractures, and compression of vein leading to edema, compression of arteries leading to ischemia, or compression of nerves leading to compression nerve injury. If the bony prominence lies on the cast directly without excessive cotton wool, friction of the cast against the bony prominence leading to pressure sore and ulceration of skin. The joints are completely fixed during the application of the plaster cast, this leading to joint stiffness. And the muscles does not contract during fixation of the plaster cast, leading to muscle atrophy. And this is the importance of rehabilitation after removal of the plaster cast. Exercise to regain joint movement and to regain bulk of muscles. If the plaster cast is too lax and the limb moves within the cast, this leading to bone redisplacement and deformity with union in bad non-anatomical position, which is called the malunion. This is the first method for external fixation, which is, and the most popular for fixation, which is BOP, plaster of Paris. Nowadays, orthoses are artificial brushes used to fix the limb or the spine, and increasingly popular because it is more comfort and more safe than plaster of Paris. As this is orthosis for ankle and the knee and the foot. Fix the foot, ankle and knee joint. And this is a forearm and wrist orthosis. For the Arabic student دي أجزاء متفصلة صناعيا موجودة لجميع الكسور والمفاصل. تشوف لك الجزء اللي انت عايز تثبته وتروح جايب الجزء المناسب والمقاس المناسب available في كل محلات الأجهزة الطبية. Also the third after Bob and after orthosis, there is this type of fixation, which is called external skeletal fixator. External skeletal fixator, the idea consists of pins passes in the proximal fragment of the fracture, and the pins passes in the distal fragment of the fracture. And these pins in the proximal and distal fragment are connected together by a special metal frame. What is the use of this external skeletal fixator? The commonest use is compound fracture. Why compound fracture? To leave the wound exposed for caring of the wound, continuous caring of the wound. This fixes the fracture, leaving the wound for frequent change and frequent examination. And it is also used in severe pelvic fracture called open pock deformity. It is also called used in polytrauma patient. Why? Because in polytrauma patient you make operation in the chest for lung injury, and you make operation in the same time for liver injury, and there is fracture. This prolong the time of the operation, and the patient cannot withstand this long anesthesia. And we want to shorten the time of the surgery and the time of the trauma during surgery, and shorten the duration of anesthesia by a rapid method for treatment of fracture. Therefore, in polytrauma patient, this stabilizes the fracture rapidly without adding any more surgical trauma or surgical time. Also, there is traction, which is another method for fixation, and we said before it is a method for reduction. Skin or skeletal traction is used for reduction, and keep this traction for the time needed for complete healing. Therefore, traction is a method for reduction, and in the same time it is a fixation. Finally, internal fixation. We said before that closed reduction is usually associated with external fixation by plaster of Paris. And always remember that open reduction during operation, I reduce the bone. and internal fixation during the operation. Therefore, always open reduction is associated with internal fixation. What is the indication for internal fixation during operation? First of all, after open reduction. This is logic. And if there is any liability for malunion or non-union or spontaneous healing and spontaneous fixation of the fracture is impossible. How? In pathological fracture. Pathological fracture is liable for non-union and the fixation is impossible in presence of the pathology. Therefore, internal fixation is needed. Or in multiple fractures. If you reduce the fracture, the other fracture is displaced. Therefore, in multiple fracture, you should open reduction and internal fixation should be done. What are the methods of internal fixation? First of all, wire suturing, like this. In fracture patella, we fix the two bones of the fracture patella by wire suturing. Or screws, like this. Internal fixation by screws, especially for oblique fracture. Or plate and screws. And this is usually used for transverse fracture and comminuted fracture. Or this. Nail introduced inside the medulla. Nail inside the medulla, it is called intramedullary nail. These are the methods of internal fixation: wire suturing, screws for oblique fracture, plate and screws for transverse fracture, intramedullary nail. Or we can use with all this method what is called bone graft. Bone graft to accelerate healing. Bone graft may be in the form of chips, bone chips, or part of a bone, plate of bone. Plate on the outer surface of the bone called onlay graft over the bone onlay, or the graft inside a groove in the bone called inlay graft. What is the source of autogenous graft? This is called autogenous from the patient. The commonest site for bone graft is the upper 3/4 of fibula, or from the anterior border of tibia, or from the iliac crest, or from the ribs. Ribs when you need a curved bone, like the mandible. Plate of bone is taken usually from the anterior border of tibia, chin of tibia. Bone chips is usually obtained from the iliac crest. Recently there is artificial nowadays there is artificial bone graft substitutes. Artificial bone graft is added to the autogenous graft as a cementing substance to fix the fracture and the bone graft. What is the advantage of internal fixation? Very accurate reduction and fixation, and early mobilization. The patient can move very early to avoid complications of prolonged bed rest. These are the methods of fixation: external fixation by BOP, plaster of Paris; external fixation by external skeletal fixator, external fixation by traction, and orthosis nowadays is increasingly popular, and finally internal fixation. After reduction and fixation, now we reach the final step in treatment of simple fracture, which is rehabilitation. The aim of rehabilitation is to prevent joint stiffness, to restore movement, normal movement of the joint, to restore the wasted muscles, to restore the bulk of the muscles and the strength of the muscle, and to prevent osteoporosis. What are the methods? During application of the plaster cast. During application of the plaster cast, when the joint are fixed in the plaster cast, the other joints, like this, movement of fingers, the other joints which are not more fixed, the patient should move always the fingers to keep the muscle contracting. After removal of the method of fixation, removal of orthosis or plaster cast, the fixed joints, continuous exercise for the joints which are fixed in the plaster cast or in orthosis, etc. After treatment of simple fracture, treatment of compound fracture, see compound fracture, which will be discussed later on in complications, and treatment of complications if occur. This is a treatment of fractures. Thank you for good listening and good luck.